Hey everyone. Okay, now this is care of the patient with a tracheostomy. Now, this lecture does not replace the need to review the green PowerPoint that says care of the patient with a tracheostomy. That is what you need before you go into the simulation lab for new skills with Ms. Stone. I repeat, this lecture does not replace the need to look at the green PowerPoint for Chapter 28, care of the patient with a tracheostomy, that you are to make sure that you go over prior to New Skills Day with Ms. Stone. This lecture, although covering a lot of the same things, will not cover everything in its entirety, but is necessary in order to be successful on the exam too. Learning objectives. Assess the patient with respiratory problems affecting gas exchange requiring a tracheostomy. Prioritize evidence-based care for the patient with trachs. Nursing interventions for a patient with a tracheostomy. Okay, the tracheotomy itself is a surgical incision into the trachea for the purpose of establishing an airway. The tracheostoma is the stoma that results from the tracheostomy. Provides best long-term airway maintenance, but also can be temporary. The indications for a tracheostomy can either be temporary or permanent. It is for relief of acute or chronic upper airway obstruction. Access for continuous mechanical ventilation. Prevention of aspiration pneumonia. Promotion of pulmonary hygiene. Bilateral vocal cord paralysis. Prolonged endotracheal insertion resulting in erosion or pain, usually after 10 to 14 days. Postoperative care. Immediately after surgery, focus of care is ensuring a patent airway. Focused assessments should be hourly and are put into great detail on chart 28.4. I would know chart 28.4. Ensure the sutures are intact and the tracheostomy ties or holder are secure. When it's time to do trach care, you always want to make sure you have your new trach ties or holder secured prior to removing the old one. I repeat, when it is time to do trach care, you always make sure that your new trach ties or holder are secure prior to removing the old trach ties or holder. Complications associated with tracheostomy. A pneumothorax, which is air into the chest cavity from the lung puncture during the procedure. Bleeding. A small amount of bleeding is expected from the incision for the first few days, but constant oozing is abnormal. Constant oozing is abnormal. Infection. Wound care prevents most infections. Subcutaneous emphysema. Assess the skin around the new trach. If the skin is puffy and you can feel crackling sensation when you press on the skin, notify the provider. This is a sign of subcutaneous emphysema. It feels like popcorn underneath the skin or like walking on styrofoam. It's a weird feeling, but once you feel it, you'll never forget it. Tracheostomy emergencies include airway obstruction by mucus plug and accidental decannulation. Now, both of these trach emergencies require immediate and urgent care. Now, what we need to do is we need to make sure that the supplies needed to care for these emergencies are at the bedside, including an extra trach tube of the same size and one size smaller, an arbitrator belonging to the existing tube. And you'll see what that is when you're in lab. It's like a stick, for lack of a better term, that goes inside the trach, the trach tube, so that you can put it in and out easier. An emergency trach insertion kit, a 10 cc syringe, in order to deflate the cuff. An oxygen source, suction catheters, and a suction source. Resuscitation ambu bag, both with oral mask and trach cuff mask, the trach mask. Trach tubes you're going to go over in great detail when you're in simulation lab. But for the purpose of lecture, the big things I want you to see is where the faceplate is, where the slots are on that, to where the tube ties go. And remember, we always make sure we have the new tie in place prior to cutting the old tie, or Velcro strap, whichever we're using. In the first small picture in the corner, you see the arbitrator there, and like I said, it's a stick-like thing that goes inside the trach tube in order to move it when they're putting it in place. And you can also see where, when the trachs are cuffed, how that how the balloon expands to go up against the trachea. Care issues for a patient with a tracheostomy. A cuffed trach tube is used for a patient on mechanical ventilation. When inflated, the tube comes in contact with the trachea and seals it off so that all air movement occurs in the tube and not between the trachea and the tube. To prevent tracheal damage, keep the cuff pressure between 14 and 20 millimeters of mercury. Check cuff pressure at least once a shift. Most, that really depends on your agency. I know the agency that I work at, cuff pressures have to be checked. Believe it's hourly, but cuff pressure should be checked at least once a shift. Now, I know you're saying all Ms. Roeder's doing is telling us to look at a bunch of charts. That's because this is going to be covered in detail in Simulation Lab on New Skills Day. But in order for it to be covered on our examination, I wanted to make sure that we had the general information about care of a patient with a trach. Trach care is in chart 28.3, and Ms. Stone will go over that with you in detail in the Sims lab. You want to ensure warm air and humidification. Inadequate humidification and warm air can lead to tracheal damage. You'll learn how to suction again in Simulation Lab, but it's important to know chart 28.2. So far that's knowing chart 28.3 and 28.2. Oral hygiene helps to keep the airway patent and prevents bacterial growth and promotes comfort. Nutrition, swallowing can be a major problem for a patient with a trach, and see the chart on page 28.5. Again, swallowing can be a major problem for a patient with a trach, and we should look at the chart on 28.5. Communication. Speech is possible with a cuffless tube or when a fenestrated tube is capped or covered. But before that's possible, usually with a new trach or when a patient is on mechanical ventilation, they have a cuffed trach, so therefore they can't speak. So you can use a writing tablet or a picture board or flashcards. All of these things are very useful in communication. Supporting their psychological needs. The inability to talk is a huge stressor. So being able to come up with a way that they're able to communicate really helps to decrease their stress. If it's going to be a long-term trach, body image can be a huge problem. And you want to make sure that you work with them as far as ways to kind of camouflage the trach when they go out in public and how to care for it. Home care needs. You want to make sure before the patient is discharged that either they can take care of the trach on their own or their loved ones can. And you have to, and don't just like what, you need to really have the family or the patient provide you with a teach back and demonstrate that care a few times. trach care is not something that should be taught on day of discharge. It should be an ongoing process from the time when it's established that the patient's going to need the trach to go home. And their caregivers need to learn how to be able to take care of it confidently. And so that's something that we would not want to do on day of discharge, but would need to be an ongoing process where they go from observing to assisting with to being assisted, and then to where they are able to demonstrate it back to nurses. Those are helps them to build confidence in order to care for their loved one more successfully. Again, this is a brief overview of the lecture for tracheostomies. Ms. Stone will go into a much more detail in Skills Lab. As far as for the exam, you're only going to be responsible for what is covered on these slides and the tables that I told you to make sure that you looked at. Now, for the final exam, you will also be responsible for the content that Ms. Stone goes over in Simulation Lab. But for exam 2, the only things you'll be responsible for is what is in this lecture and the tables that I told you to make sure that you looked at. Thank you.